HELM stands for Health, E-Learning and Media.
HELM are a very forward-thinking team. We don't just believe in using new technologies for the sake of it.
The impact of HELM is in the way that it works. It's a very, very collaborative outfit and therefore highly useful.
It's enabled our teachers to expand their skills in the provision of teaching and learning.
What I really like as well is that you can go along and say, I don't know what I want, and they'll have answers. Or you can go along and say, I know exactly what I want, and they can make that happen. So brilliant, brilliant impact.
So the four arms of HELM are curriculum, research, communities and open. And these are connected and intertwined, and together they form the heart of HELM, our strategy and practices.
We've been looking at the impact of open educational resources, the global impact and the local impact within our students, within our own courses.
We support students, and students feel very supported in using the learning technology, and we're very proud of that.
Participation and collaboration are at the heart of everything we do in HELM. We work with each other and we learn from each other. We build partnerships with communities and we share our learning across the globe. We opened up our e-learning design methodology to over 6,000 learners in 50 countries on our MOOC, Designing E-Learning for Health. It was the first MOOC in the university delivered by a whole team. It was HELM, together with staff as well as students. Everyone was involved, from professor to apprentice, from teaching, facilitating and developing a resource.
Within healthcare settings, we've been working with patients in participatory design workshops to develop resources that will help them to understand complex scientific concepts that might be related to the diseases or the conditions.
The other side of HELM's research work is, of course, applied to healthcare. So a good example of that, we're developing digital technology to help people with hearing impairments basically deal with their own hearing impairment better, so that they rely less on the use of health services.
Community of practice is all about really winning hearts and minds. It really helps to engender the spirit of community, and it really helps everyone involved in the project feel part of it and feel focused.
So the clients, the user groups, the practitioners, the academics, that means that what it produces is really authentic and relevant. HELM's reach is now truly global.
I'm very impressed with the team's work on using the latest technology to develop health-related educational materials for medical students and patients, making complex concepts simple and understandable. Thanks for the Health E-Learning Multimedia team from the University of Nottingham, which has introduced this concept to me and my research team at the University of Malaya, Malaysia.
The vast majority of the resources are developed with public funding in one way or another, and therefore we want to ensure that they have the maximum possible impact. We know that the resources are now being used in over 50 countries worldwide across all continents, and we also know that we have an estimated user group of about 1.5 million people.
The HELM team is a unique team. Our delivery relies on an ethos that embraces collaboration and participation at every level. So our partners, collaborators and co-designers in much of our e-learning resource development include students, teachers, clinicians, service users and carers. They provide expert and authentic voices that tell genuine stories that we can then convert into an accessible digital format.
Goodbye.
Thank you very much. Thank you.
Bye-bye.
So long farewell. I'll for you to say goodbye.
I hope you're recording this.
Oh, no.
Watch their takes.
So long.